Kai's journey with VRCCO began in November 2022 when she was brought into our oncology service for lameness in her left hind leg.
Kai was diagnosed with a lytic bone lesion. Generally, when dogs present this way, there is a high likelihood that it is going to be a type of cancer called osteosarcoma. Typically, dogs that are diagnosed with osteosarcoma are considered to have what we call a guarded prognosis overall, meaning that unfortunately many of the pets will succumb to the disease at some point within their lifespan.
I just felt like completely in shock that it was unfair. Never in my wildest dreams did I think that we would be facing a challenge like this. I'm not naive to the fact that our best friends don't get to live as long as we would like them to.
In November of 2022, she did have a left hind limb amputation that did require us to take a little portion of her pelvis so that we could make sure we removed all of the cancer from her body. And then once that took place, we were able to analyze the tissue, which did confirm the type of cancer we were suspecting, called osteosarcoma.
The decision to actually go forward with the amputation was really tough for us. I initially was very hesitant to do it just because I was worried it was really going to be a negative impact to her quality of life. Once I started to think about it, I needed to give her a chance. Like, she's very tough, she's gritty, and if anybody was going to beat it, it would be Kai.
In the months that followed, Kai underwent chemotherapy, concluding her treatment in May 2022. Since then, Kai has been returning to VRCCO every 2 to 3 months for chest x-rays and physical exams. To this day, she remains cancer-free.
She did 10 miles in February on a hunt on 3 legs in the snow, and she's 12 and a half years old. So she's thriving and she's very sassy, so I think she still feels pretty good.
Kai's case is a good example of how advanced veterinary medicine can impact the outcome of an unfortunate diagnosis. However, cases like this are costly to treat because they involve a lot of diagnostic testing, surgery, chemotherapy, and other medications. Fortunately for Kai, her pet parents had pet insurance, which helped ease the financial burden.
The day that I brought Kai home, she was close to 12 weeks old, and I immediately applied for the pet insurance for her, just knowing that with an active dog that's hunting, potentially could have ACL issues. She's run through barbed wire before, all of those things. I just wanted to make sure we had that added protection.
Insurance can make a world of difference in helping you protect your pets. If you haven't yet, consider exploring your options for pet insurance. It's one of the best ways to protect your loved ones before they need it most.
I think having the peace of mind of having pet insurance, it just allows you to do more for your animal in the event that you need to use it. It really allowed us to do everything that we did in order to give Kai the right support and care that she needed through this whole cancer process.